your pricing component data templates, including the specific NDCs for which the reporting is required, are available for download in the prescription drug portal. And we did that last week. So for those of you that are required to report this round, those templates are available. And then the templates are due to us completed by May 16th. Next slide. So there is a new registration requirement that you may have noticed, and we just wanted to point this out, that there was a law that was passed in the last legislative session that requires manufacturers of insulin to report their wholesale acquisition costs. And the rule that will govern that data submission is in process. It's what we refer to in state government as a major substantive rule. So it goes before my board for a provisional review, and then it goes before our legislative committee of oversight for a public hearing, and then their review and recommendation to our full legislature, and then it will go to the full legislature, the House and the Senate, for a final vote. So our legislative committee of oversight took the proposed rule up earlier this month, I think it was. I'm kind of losing track of time. And they voted it out unanimously in support of. So now it will go before the full legislature. And assuming that that gets through that process, we will send out communications to folks, but we will not be requiring the submission of that data until beginning in 2026. But we are asking, as part of the registration, that you let us know if you are a manufacturer of insulin. The new rule, assuming that it all goes through, will be referred to as Chapter 800. And again, we'll do a whole lot of communication to those manufacturers that will be subject to this new requirement. Next slide. So the pricing component data templates, we try and be very focused on what we're asking for in terms of this detailed data. As you know, right, there are thousands of NDCs. We've got to try and keep the reporting that we're doing, that we're required to do under state law, focused. And therefore, we are focusing on the top 25 most costly, most prescribed, or those NDCs having the highest year-over-year increase. And the time period that we were looking at for this year's selection of drugs is July 1st of 2023 through June 30th of 2024. And then we also look at the top NDCs with the highest average per member out-of-pocket costs for the same time period. And then we are also looking at pharmaceutically equivalent with the same package size as an NDC described above. So that, again, is not all drugs. We're not asking for pricing component data on all drugs, but if you move to the next slide, I think we're quantify for you that for the 2025 reporting period, we're asking from the manufacturers, 124 of them, and I think there's something like, I don't know, I think directionally this is right, 600 or so manufacturers that are licensed in the state of Maine. Of the 124 that we're asking for pricing component data, it represents 766 drugs. And we are asking from the wholesale distributors and pharmacy benefit managers a total of 154 entities, again, representing 766 drugs. So I know this is, well, I'm guessing this is not your favorite thing to do, and we recognize that. This information, though, is so incredibly important for a lot of the discussions that happen in our state around the cost of drugs and utilization of drugs. And I think it's really important that people understand the aspects of pricing along the supply chain, and this helps with that. A lot of times, absence the facts, people, sort of think they know. And so it's helpful to actually have the information to be able to express it factually. And so we are mindful of that and mindful of the administrative burden. And so again, limiting to 766 drugs this cycle, which I think is down from previous cycles, which have been maybe closer to over 1,000. Next slide. And I think here I am turning it over perhaps to Sarah, who will take it for the next couple of slides, and then I'll come back and wrap things up.
Thank you, Karen Lee, and good afternoon, everyone. As Karen Lee mentioned, my name is Sarah Brewer, and I'm with the Human Services Research Institute. We partner with the Maine Health Data Organization to help with the secure submission of data to the MHDO, and I'm very excited to be talking with you today. So quickly, just to go over Chapter 570, Annual Registration. You should be familiar with this. Annual registration has been completed for this year. It was due earlier this year. So this was the confirmation of company summary information as well as company users. And as a reminder, user information is required for communications from the MHDO and should be updated as often as needed to maintain timely, focused communication. Next, I wanted to go over the next step in this process, which is the submission of the pricing component data templates. So you'll see here we have a snippet of what this data template looks like. And if you've reported previously, I'm guessing that this pricing component data template will look similar to you because it's similar to what was used last year. These are Excel documents loaded into the portal for entities who are required to report. And one thing I want to highlight here is that it is very important not to add rows or columns to this spreadsheet. This is because we validate based on the formatting provided to you. And so if you do add rows and columns or modify the formatting of this template, it will be rejected when you try to submit it back into the portal. And so that's something I wanted to emphasize so everyone is aware. At this time, if you are required to report, a template should be accessible to you in the prescription drug price portal. And we'll walk through this today where you can access that template. But in sum, you will go to the portal, download the template, complete it in your own environment, and then submit it back into the portal by May 16th. And as a reminder, do not send templates back via email. Before we walk through the portal, I also wanted to highlight some information about data quality process improvements. So in previous years, the MHDO manually reviewed data submissions and coordinated with reporting entities to verify data values that did not fall within expected parameters or where data corrections were required. Beginning last year, the MHDO and HSRI implemented process improvements to provide earlier data quality feedback to reporting entities through scheduled automated data validation processes. And so these process improvements will be applied again in 2025. Some common validation issues and their solutions are enumerated in these next two slides. For an invalid template, entities will need to wait until March 17th. That date has passed, so we've now uploaded the new templates into the system. So this should not be an issue. I guess one thing I want to flag here, though, is obviously do not update and resubmit a template from a prior year. That would cause it to be an invalid template. Another common data validation issue is when data values are not provided for one or more NDCs in the template received. And in these cases, please resubmit an updated template containing values for all NDCs. Do not delete records or fields, and if values are not applicable for a data element, please enter 0. A third validation issue is that all financial values are duplicated across multiple records. In these cases, data should be provided specific to each NDC individually. And then we also have data values are not provided for one or more NDCs or one or more columns. And these instances provide missing values in the specified fields. And if values are not applicable for a data element, enter 0. There are also a number of validation warnings that are all associated with one solution. So I'll quickly run through these. Pharmacy reimbursement values are greater than payment receivable values for one or more NDCs. Pharmacy reimbursement values are significantly lower than WAC when evaluated per pricing unit administered for one or more NDCs. Rebate payable values are greater than rebate receivable values for one or more NDCs. Rebate payable values are greater than payment receivable values for one or more NDCs. And finally, rebate receivable values are greater than acquisition cost values for one or more NDCs. So validation warnings are intended to alert reporting entities to potential data issues. In all of these cases, financial values should reflect amounts accrued during the reporting period, whether or not payment was actually made or received. At this time, I'd like to provide a step-by-step demo of our portal. If you go to mhdo.maine.gov, there's an easy way to access the prescription drug price portal up here in the upper right-hand corner. So from that link, I can log on. And you'll notice here the opportunity to put in your username and password in order to log in. And then in addition, there's also important links down here. If you forgot your username or password, you can recover your existing account. And then if you have any other questions, please feel free to reach out to our help desk at mhdohelp.hsri.org. My colleagues at the help desk would be more than happy to assist. So I'm going to log into the portal now. This is the home page, and while I'm here, I'd like to highlight some key features on this page. First of all, users can edit the details of their own accounts at any time by going to the Hello and then the username link found at the top right of the portal screen. If you click the link, then you'll be taken to your user details where you can change your password or edit the details for your user. On the home page, you'll also see what entity you were logged in under, and this is especially helpful for those users who are associated with multiple reporting entities to know which account you are under. In addition, on this page, you will also see the template submission status for prior years and this year, as well as the assessment payment status. So again, just summary information there. Next, we'll go to the summary page. And the information displayed here is the information we have pre-populated for each reporting entity. And it is also the information that you updated during registration. Again, registration was due earlier this year, so you should have completed this already. However, at this time, I'd like to take the opportunity to spotlight 2 changes we made to registration this year, just so everyone is aware. First, for manufacturers, there's a new question asking if the manufacturer manufactures insulin. If this is the case for your entity as a manufacturer, then you would need to indicate this with the checkbox that is in the registration. Second, this year we integrated the third-party services provider form into registration. And this form must be completed by entities who make use of third-party reporting services. During registration, entities had the option to download the TPSP form from the registration page. And as a reminder, once that form is completed, you should submit it by emailing the completed form to the MHDO help desk. So that covers registration. I'd like to now go to templates. And you'll see that we have the pre-populated template here, which means that this entity is reporting. And this should be downloaded by clicking the download link and completing the template in your own environment. And once you're ready, you can submit the template by clicking on Submissions. Here, you'll see a summary of the previous year's submissions. And if you click Submit File, you can choose your file and then submit it. And when you are going to upload your template, please make sure that you follow the file naming guide so that this will be successfully uploaded. Finally, I want to spotlight a few of the resources that we have available in order to help assist you in providing your information and pricing component data. We have a Contact Us. This information is also available at the end of this slide deck, which will be posted on the MHDO website. We also have a user manual that provides step-by-step instructions, as well as a frequently asked questions page for any questions you might have that might be an easy reference. Finally, you can log out by going to the Log Out button on the top right of the screen. And at this point, Karen-Lee, I'm going to share the slide deck once again, and I think it is back to you.
Excellent. Thank you, Sarah. All right, so this slide is just a reminder that there are requirements under state law and that there is also enforcement if we're having issues with folks complying. And I'm happy to say that we've not had to enforce you know, the people have been really good at submitting the data. So I want to thank you again for that. I'd rather work with you to meet these requirements versus, you know, the alternative. So thank you. Next slide. So a list of links to the various pages on our website with the information that we just went over, and where we will post the deck. I have not yet seen any questions for the general population. I did receive one direct, but that was a much more specific question to a user, and I will respond after this session. But we would post any updated FAQ as well as a recording of this webinar on the page that says pricing component data. Next slide. And here is, again, a page that lays out the contact information for our help desk. If you have any technical issues that you encounter when you're working in the MHDO prescription drug data portal, and also if you have questions specific to registration and or assessments, please reach out to Philippe Bono. And if you have questions regarding the data submission and or the need for an extension to the deadline, please reach out to the folks at 10 to 11 Business Solutions, which is working with us through this process this year. Next slide. Again, if you've got questions, I think we're getting close to the end here. If you want to get those in the chat before we end the call, that would be great. And then I think the pages that follow are a listing of the entities that would be exempt from the Chapter 570 requirements. I think, again, now that we're in our 6th year, I think people are pretty clear whether they are on this list or not. But just as a reminder, these are the entities that would be exempt from this mandate. And again, this will be posted online within the next day or so. And I think, Sarah, that concludes our session for today. I just want, if anybody's trying to get a question in the chat. I just want to wait a second. Otherwise, again, I want to thank you all for taking time out of your busy schedules to join us this afternoon. We are always open to feedback. If we can improve the process for which you're submitting data, please do not hesitate to reach out to us. And I thank you in advance for those of you that are submitting pricing component data this year, for getting that in. Again, we've tried to balance the need for information with the administrative burden. And on that note, I'm not going to prolong this. If people do have questions, you've got resources, don't hesitate to reach out to us. And again, thank you. And I hope everybody has a good rest of their day.
Thank you.